This is an interesting study because it raises a new concept about osteoarthritis, which is the role of inflammation. Osteoarthritis are always a painful condition. Usually conditions with pain have inflammation or nerve problems. But in the case of OA, it's probably inflammation. Even though we usually consider OA non-inflammatory, there are a group of patients who have more inflammatory disease. So what this study looked at is a population of patients with osteoarthritis who had evidence of inflammation either by physical exam or ultrasound. These patients could not be on other agents, although they were withdrawn from non-steroidal anti-inflammatories. The take-home message is in this group of patients, glucocorticoids were effective. They reduced pain, they reduced synovitis, and overall a positive study. The question is generalizability. Of people with osteoarthritis, how many would have this so-called inflammatory pattern? I think it's important, however, for physicians and providers to look for this pattern of disease, not just consider OA to be degenerative, and then treat appropriately for this subpopulation. You know, this is a study that's going to attract patient interest and provider interest. You know, right now we do not have a specific therapy for osteoarthritis. We treat it with non-steroidals, which in that population is potentially problematic because of cardiovascular disease. We treat with acetaminophen, which even it has issues in terms of hepatic toxicity. Neither of them are as effective as we like, so this gives an option. Obviously, glucocorticoids come with side effects, and it's going to take time to figure out the doses required, the duration of time, and how to benefit patients without giving them too much harm in terms of toxicity.